afternoon, early afternoon, what time zone you're in. Hello, my name's Courtney Chase. I'm with Genentech. I really want to thank everyone for making the time to come and join this webinar. We're excited that we're able to have a panel discussion around everyday experiences, perspectives on life with SMA and treatment choices. And I just want to thank our panelists and Dr. Catrullo for being here. And we hope that it's an interactive and robust discussion. So before I turn it over to our host, Dr. Catrullo, and the panel, I just wanted to go through a couple of reminders, housekeeping notes, before we begin. One thing we always say, in order to help with your Wi-Fi, if you could turn off any other devices that you have, that helps with the performance of the platform. Your mics and your cameras are disabled. That's to keep background noise down, but you can at any time add a question through the chat function. So please, throughout the program, submit your questions. And what I'll do is I'll come back on at the end and I will go through them and answer as many as we can. Just so you know, we are not able to answer anything that's off label. So if it is off label, I'll just have to let you know we're not able to address it, but you can follow up afterwards with our pals, and they can help you get your answers to your questions. And also, if we run out of time and I don't get to something, I don't want you to think that we don't want to address it. We're just going to keep an eye on the time and make sure we end on the hour to respect everyone's time. And then importantly, at the end, we have a QR code that'll come up, and that's our survey. And we hope that you'll take a moment to finish and take that survey, because that allows us to continually improve our programs. So thank you for your time. Before I turn it over to Dr. Catrullo, I will come back on and moderate the Q&A, but now I'll turn over to Dr. Elizabeth Catrullo, who is the neurologist at Children's Hospital of Philadelphia, and we appreciate her making the time to be here and moderate this. So thank you, Dr. Catrullo, for being here.
Thank you so much, Courtney, and thank you to all of you that have joined us today. While I am a pediatric neurologist, certainly our care for patients doesn't end magically when they turn 18, and despite being at a children's hospital, I think my oldest patient with SMA is currently 39, and really ensuring that we have adequate care for our patients with, what is often considered a pediatric disease going into adulthood, I think is something really important. I'm also really happy to be part of this type of panel presentation, because I think it's really important to hear from peers and from other individuals who are living with SMA about their experiences. And so I'm happy so many of you have joined us today. I also want to thank the MDA for hosting another great opportunity for the community to come together, even though we're resorted again to this virtual type of forum, but I know in many ways it makes it easier for more of you to join us. So today we're going to talk about Evrysdi, which is a treatment for adults, children, and infants with SMA who are 2 months of age and older. Our conversation today is really going to focus on Evrysdi in adults, and we'll include a review of some of the clinical trials that we have, as well as perspectives from some of our community members who are joining us today. And they'll be able to speak more specifically about their experience with Evrysdi, as well as their experiences living with SMA. So I'm happy to introduce them. So if you guys don't mind turning on your videos briefly so that we can get to meet all of you. So joining us today, we have Shaniqua, who has type 3 SMA and is joining us from Maryland. Dan and his wife, Millie, are joining us from Los Angeles, and Dan has type 2 SMA. And Jim is joining us from Indiana, and he has type 3 SMA. So we're all over the US here. Thank you so much for joining us today. So before we get started, I just want to go over a few background things on Evrysdi. So just to review in general, this program is intended to provide general information about Evrysdi and not any type of specific medical advice. And so always talk with your doctor before making any individual treatment decisions. This program is being monitored and any adverse events have already been reported. Myself and some of the other panelists have been compensated to be here today. We can go ahead and go to the next slide. Thank you. So there's some important safety information that we want to review. So before taking Evrysdi, it's very important to discuss with your healthcare provider all of your medical conditions, even if you think that it may not be related. There are also some particular concerns regarding pregnancy, fertility, and breastfeeding. So risdiplam or Evrysdi is not recommended to be taken while a woman is pregnant. And so it's recommended that women of childbearing age use birth control while they're taking Evrysdi and for at least 1 month after stopping the medication. We don't really know about its effects in breast milk, and so that's something else that you should really have a talk with your doctor if you are currently or planning to start breastfeeding. And also for the men in the group, Evrysdi may affect a man's ability to have children in the future. And if this is of concern to you, you should talk to your healthcare provider for advice about options, including sperm preservation. Next slide. It's very important to tell your healthcare provider about all the medications that you take because there can be interactions with Evrysdi and medications for other chronic medical conditions. If you're prescribed something new, it's always a good thing to double check with the pharmacist if there's any potential interactions. Evrysdi is supplied as a liquid, so if you're getting a shipment, you want to make sure that it looks like it's supposed to. If it's a powder, you cannot use it. It needs to be properly in liquid form. And as with many medications, you want to be careful about ingesting Evrysdi as you're supposed to and avoid getting contact in your eyes. Next page. So there are currently over 1,600 people in the US who are taking Evrysdi for SMA, ranging from young infants up to those in their 80s. And this doesn't include the 450 patients who were enrolled in the clinical trials. Clinical studies of SMA at this point, we'll talk about them today, but they've included individuals from early infancy up until the age of 65. And so we continue to learn more and more about its efficacy in the adult population. And so with us today are some of the more than 1,600 patients who are currently taking Evrysdi. So I want to take a chance to get to know our panelists a little bit more. So I'll give them a second to turn back on their video so that they can all join us. So Jim, how about if you get us started? Can you tell us a little bit about yourself?
Sure. First off, I want to say thanks for this opportunity to share my story with folks. It's always good to do. But I live in Indiana with my wife, Cheryl. We have 2 grown daughters who are now gone and on their own, presently doing voice work for commercials and training videos, explainer videos, things along that line. I'm getting to the age where I have some friends who have retired, and I'm thinking, you know, what would I retire? What would I do? And the answer is, I do what I'm doing today. I'm kind of enjoy it. So I'm very fortunate in that regard that I get to do something that I enjoy every day. Now, one thing I do, I'm still a member of the volunteer fire department that serves my area. Was an EMT with them for many years. I'm not able to make scene anymore, but there's always a job to do. I can still teach CPR and EMT classes, still review the books. And so that's something that I have always enjoyed and continue to enjoy and participate in. So that is good. Overall, though, I guess working and exercising have been 2 of the priorities that have been paramount in my life. I still have always been an athlete. I've always enjoyed participating in sports. Obviously, I can't do that anymore, but I still exercise and make sure that I'm taking care of my body there. As of today, again, I'd like to thank you for the opportunity because my insight, I tell folks, is a little bit different than most folks. I've been battling this disease since the mid-70s. So I have a long and storied history with it, and to be able to know that there are treatments available now is very exciting. So I do bring a unique perspective.
Thank you so much, Jim. And it's great to enjoy what you're doing enough that you don't want to retire so urgently. And certainly we've seen so many advances in science, and particularly in SMA in the last decade, that it's great to see where things are really moving towards. Shaniqua, can you tell us about yourself and why you decided to join us today?
Sure. I also want to thank you all for giving me the opportunity to speak about my experience. It was a pleasure for me to be here today. I like to think of myself as this fearfully and wonderfully made woman of faith, striving in my purpose, right? I was diagnosed with SMA type 3 when I was 2.5 years old. I'm on this journey we call, living life, but I'm doing this like with a hopeful heart, right? I work as an attorney. I'm specializing in the area of equal employment opportunity. My career requires for me to be impartial on a consistent basis, but so I review complaints of discrimination, right? So not to brag, but I did receive a Peacemaker Award in the 5th grade. So I try to bring that passion with me every day in my life. I do live alone. And when I'm not working, I like to read, hang out with my family. I love going to the pool, to swim. I love to eat a lot, and I love to spend time with my church family. But I'm really happy to, again, like I said, to be here today. Thank you for giving me this opportunity to be of service to others. I love to serve others. My family, they helped me to realize that my disability is not because of anything that I have done wrong. I just want to let everyone know that I belong here, I'm enough, and I hope to share more of my story with you all.
Thank you so much, Shaniqua. I think it's so important that we have advocates like you to stand up for people who may still be struggling to kind of find their voice, which is something I think so many of us really struggle to do. That idea of speaking up for yourself and your needs, I think really resonates with a lot of what we're going to discuss today. So Dan, can I shift over to you? Can you tell us a little bit about your story?
I'm Dan, and I love this opportunity as well. Thank you. Echo the same as Jim and Shaniqua. Anytime that we can help, perfect opportunity. I'm a software engineer, and I work on internal applications for my company. I really enjoy it because I get to work with a lot of different people, and I'm a people person. So maybe also because I'm a people person, but also just because I love humor. I also moonlight as a sit-up comedian. I've been performing at comedy clubs for about 8, 9 years now, and I just enjoy making people laugh. It feels good to be up on stage and hear people laughing intentionally at my jokes. It's like an adrenaline rush for me. It's like my sport, I guess. I decided to join today because I believe in every opportunity to help others with SMA or any type of disability, and it's an opportunity I want to dive into because it is within the community that we can help each other the most. And I really have my lovely wife, Millie, to thank for my latest phase of my journey.
Well, I have to say I'm very impressed with your courage to be a comedian. I don't think that that is something I could ever do. And Millie, thank you so much for joining us today too. Can you tell us a little bit about yourself and why you decided to join us today?
Yes, hello guys. I'm Millie. I'm currently in school and I hope to go to school to become an OBGYN with a specialty in oncology, so cancer and babies. And as a couple, Dan and we love going to the movies, going out, traveling, eating. Our game nights are epic, especially cards, because we're really competitive. And he hates when I win, and I really hate when he cheats. So, like, yeah, game nights get real.
I don't cheat, you cheat.
Oh, and we love food. Sorry, he cheats. Yes, we love finding new restaurants, but also cooking together at home is very, very fulfilling. As for today, I think these conversations are so important to have with the community. Dan doesn't understand how other people see him so positively, and I just love this man. I want him to see I want to see him do so well and share his experience with others because I know it can help. He's been through a lot, and I know he can really help, and it's important to share.
Well, thank you guys so much all for sharing and for these introductions. I can't wait to kind of talk more to you. I will just briefly introduce myself. So I live with my husband, 2 children, a cat and a dog, and I can't say if my kids get along worse or my cat and my dog get along worse. But like Dan and Millie, we also have some epic game nights, and thankfully I'm not the most competitive person in my family, which helps. So I think that this is going to be a great discussion, so let's go ahead and get started. So as you are all adults who are living with SMA, I think your experiences and perspectives are really important. And as our knowledge and understanding of SMA has advanced, and as we've had more treatment options, we've certainly seen a lot of change over the last few years that I don't know that we could have really anticipated 15 or 20 years ago. So let's talk for a minute about the decision to explore SMA treatment. Shaniqua, can we start with you? What motivated you to seek out treatment?
So when I was younger, I did a lot of therapy and swimming to help my muscles, but I just stopped because it really wasn't helping much. I saw a neurologist every year, but there was no treatment available, at the time. So there really wasn't much that we could do to manage my symptoms. So we did as best as we could, me and my family. And then I went through law school, and that was a really defining moment for me. As my SMA progressed, I fell a lot, and I was unable to get up on my own, and I needed a lot of help. Ultimately, I talked with my neurologist because I believe I was becoming weaker each year. I wanted to try to maintain my current strength that I had.
So I think you really bring up a very important point, Shaniqua, that SMA really is a progressive disease. And I think sometimes it's hard because, certainly in SMA type 1, we see the changes over a much more acute period. But later in life with SMA type 2 and with SMA type 3, we're often seeing changes year to year and not over so rapid of a span of time that it's much harder to sometimes pick up on those changes that we see. And while there weren't any SMA treatments available for most of your life, thankfully we have additional options now that can help to alter disease progression. And I think that that's really great news for everyone that's living with SMA. So what about you, Dan? What motivated you to seek out treatment?
Well, I was raised with 2 brothers that don't have SMA, and my family didn't treat me any differently. I also had physical therapy when I was young, but once that stopped, for a little while after I got into junior high, I didn't even really go to the doctor for anything about SMA. And as a result, my disease progressed, as you mentioned. I heard about the first treatment being FDA approved, but I wasn't all the way caught up on the info and up to speed with everything at that time. And I pretty much just accepted the life I was going to live and my condition I had. I really didn't want to change what I was doing until Millie gave me a new purpose to take care of my health.
I was originally Dan's caretaker, and it turned into more. He became my best friend, and from there, I just fell in love with him. Well, fell in love with my best friend, and that's where we are today. And I was so mad at him for not getting treatment once it was available. I was very, very emotional and put my heart out there, just letting him know how much I care about him, and I really wanted him to care about himself.
Yeah, if I'm honest, what really motivated me to start taking treatment was Millie actually telling me how important it was for me to be healthy for her. And it wasn't until I realized how important that somebody else, that I understood how important I was to somebody else, that I understood my life was a lot more than just about me. And so I no longer no longer worried about what I wanted to do, so I did seek treatment, meeting with my doctor and my neurologist.
Thank you so much for sharing your story, Dan. I think that that's actually really common, where a lot of times it is kind of the loved ones that really do participate in a lot of those conversations that often do push individuals towards treatment. Jim, can you tell us what pushed you to start treatment as an adult?
Sure. But again, my story is a little different because years ago when I was, quote, diagnosed, and I don't even call it that, I first started doing doctoring. They didn't know what SMA was, and certainly there was no confirmed test for it, no genome project. Medicine was really quite different then. No approved treatments, and yeah, you know, a cure was not even discussed. But I've always lived a healthy lifestyle, participated in sports, outdoor activities, hunting, fishing with the family and whatnot. So I've always been active. And to that end, I've always tried to maintain a degree of health. The thing about the disease is it's slow. Be it good or bad, it slowly progresses. You know, imagine there's 100 things that you do every day. Now there's more than 100, but imagine there's 100. You get up in the morning, you walk to the bathroom, you kiss your wife, answer the phone, hug your kids. There's 100 things that you do. If one or two are taken away, it's not a big deal. You can't bend over and smell the flower in your garden anymore. Is life still worth living? Of course, but it's different. And eventually, as more and more things go away, bad things are added, and it doesn't get any better. So to that end, one of the things that I've always done is maintain an ear to the ground and try to figure out what's going on in the SMA community. There have been seminal events throughout my life where I realized, yeah, you know what, medicine is changing. I need to become involved. And so I've been involved in many clinical trials throughout the year. So when there was a clinical trial for SMA, I realized that I would be a good candidate for it because I've maintained as good of health as possible. And so that's kind of the short story, if you will, of how I became involved in and just let me tell you, having the opportunity to accept any kind of a treatment, to me, is a luxury because I've seen it from beginning to end. And to that end, it's exciting to know that there are treatments available.
Thank you all so much for sharing your perspectives. I also appreciate that they're all different, and I think it shows how different all of the approaches can be. And it doesn't really matter, you know, what type of SMA you have. You know, we do know from the natural history that motor function does change over time. And I think as a physician, I think that's where oftentimes I really do want to be able to start my patients on therapy, knowing that we can do something, right? When I first got into neuromuscular, I was told, why would you want to do that? You can't change anything. And I haven't been practicing very long, and boy, have things changed. And so I think it's wonderful to really be able to have more options to improve the health of our patients. So I would very much encourage any adults that may have fallen out, and there were many patients who no longer followed with us because they didn't feel like we were doing enough, to really try to reach out and get back in contact with an SMA team. So let's talk a little bit more about your decision to take Evrysdi. Jim, can you tell us about why you chose to start?
Sure. First began hearing about Evrysdi on Cure, SMA, and then of course, clinicaltrials.gov. I keep an ear to the ground there also. There was a clinical trial that I found out about being offered through Columbia University, and I was fortunate enough to become part of that clinical trial. I've done several over the years, none of them panned out at all, but obviously this one, designed for our disease, has worked out well. But also one of the things that drove me toward that is what I heard about it from the community. I'm in the group of the 25 to 60-year-olds that were part of this trial, but what I heard about from the younger people was all positive. And so when this became available and I applied for and got accepted into the clinical trial, I knew it was going to be a good thing for me.
I think community events and forums like this one and the communication that we get from Cure SMA and MDA are so helpful about keeping up with the latest things in SMA research. And hopefully this conversation will be helpful. As a busy adult, which I think we're all struggling with, options that fit into your routine are important. So what about you, Shaniqua? How did you decide to start at RISD?
I'm gonna be honest. So while I was in law school, getting on the treatment was the furthest thing from my mind, right? When I get on treatment, I went to see my doctor, and when it became available, I wanted to see what fit right for me. So after I graduated from law school and I started to work, I was more eager to begin treatment, especially since I was struggling with the decline of SMA. A close friend of mine with SMA type 2 told me about Evrysdi and encouraged me to do my own research. I was concerned about the storage and how would it affect my fertility. But after talking with my neurologist, we decided that Evrysdi was a good option for me. My doctor explained that Evrysdi is an oral medication and it treats SMA in adults and children. I like that it was an oral medication that might help me improve or maintain my motor function.
Thank you so much for sharing, Shaniqua. And we're going to talk in just a little bit in more detail about how Evrysdi works. But before we get to that, Dan, we'd love to hear from you about your decision to start treatment.
Well, I really have Millie to thank for that.
And I really have my mother-in-law is the one who told me about Evrysdi. And I told Dan. I learned about how Evrysdi is designed to work, and I read about the clinical trials and the results. And I also like how it was taken orally. And I felt just like this was the perfect medication for him. But most important to me was that Dan, as a living adult with SMA, prioritizes his health. And when we definitely had a conversation about taking more of an active role in his medication and his daily living, we have so much to look forward to together, and we really want to start a family.
Yeah, we really want kids. And as I said, I hadn't really considered treatment before Millie even came into my life. And I think it was more of a out of sight, out of mind type of thing. Of course, I knew SMA was progressive though. Once we had the conversation about our future, I got excited about possibly getting treatment. Right after Evrysdi was approved, I called my doctor to talk about it. Millie and I also discussed it, and we agreed, the three of us, that it was a good option for me.
Thanks, everyone. I really appreciate all of you sharing your viewpoints and your personal experiences. So now we're going to kind of take a pause from this lovely panel discussion, and I'm going to review some of the more specific information on how Evrysdi works and what we've seen from the clinical trials. So as I'm sure all of you know, SMA is caused by having insufficient amounts of SMN protein. So in healthy individuals, most of the SMN protein is made by the SMN1 gene, but individuals with SMA have mutations in both copies of the SMN1 gene. They still make a little bit of functional protein because the SMN1 gene has a kind of copy called SMN2. But it differs in some of the spelling of its DNA, and some of those spelling errors as compared to SMN1 make it so it doesn't make as much functional protein as the SMN1 gene does. So Evrysdi is made to increase the amount of functional SMN protein that we get from the SMN2 gene. Next slide. So we know from the clinical trials that Evrysdi does what it's designed to do. So because Evrysdi is given orally, we can measure the SMN protein just in the blood because Evrysdi goes everywhere and can cross the blood-brain barrier. And after 4 weeks, we see about a 2-fold increase in the amount of SMA protein, and that's sustained over a year on treatment. So this just kind of demonstrates that, the goal of the medication was, can we, help to correct the root cause of SMA, increase the amount of SMA protein, and we have data here showing that that happens. Next slide. So now I'm going to go back and look at some of the clinical trial results showing more of the efficacy of Evrysdi. So we sometimes think of the SMN protein levels as a biomarker. Is it doing what it's designed to do? But then the secondary thing is this actually causing motor improvements in the patients that we're hoping to treat. So the Sunfish trial is the Evrysdi trial that focused in on individuals with SMA type 2 and type 3, spanning 2 to 25 years of age. So part 1, I'm not going to talk too much about. That included 51 patients, and that was really to explore what would be the optimal dose and the overall safety profile of Evrysdi. But what I'm really going to focus in on is part 2, and this was the placebo-controlled trial to really try to look at efficacy. So it included 180 adults and children who were non-ambulatory. So they could have been type 3, but they were currently non-ambulatory when they were enrolled. And they were really meant to kind of capture the broad range of patients with SMA that we see and the broad variety of individuals living with SMA across the world today. And so many of them, about 2/3 had scoliosis, about 1/3 had severe scoliosis, many of them had contractures, which we know can create some limits in terms of what we can expect to see on outcomes. So it has a very broad patient population. Can we go to the next slide, please? So the main outcome measure that they were looking at was a change in a motor outcome measure called the MFM32. So it looks at a wide range of motor function abilities, including standing and transfer movements, upper and lower body movements, as well as more distal hand and foot movements. And so the nice thing about it is that it's one scale that captures a very broad variety of patients. Sometimes with some of our other more focused scales, we kind of hit floor or ceiling effect. If you're at the maximum or the minimum score, it's really hard to see a change. And so that's one of the benefits of the MFM32. Next slide. So what we see is on this slide, the blue is those that received treatment with Evrysdi, and the gray is those that received placebo or the sugar pill version. So they didn't know whether they were receiving drug or placebo. And those that were receiving treatment increased their MFM32 by an average of 1.36 points after 12 months. And this was clinically significant compared to those that received the placebo. Next slide. As more of an exploratory measure, they've since looked at some of the data acquired in an additional 1-year extension phase. So the patients who were receiving Evrysdi for the first 12 months were allowed to continue on medication for an additional year, and they were still monitored as part of the study. And what you can see here is that the increases that these individuals had on their MFM32 were really maintained over that second year in treatment. Next slide. One of the other outcome measures that was used in this trial is something called the ROM, and this is something much more commonly used in the US than the MFM32, so many of you may have had this testing. It looks at upper limb strength by evaluating the performance of daily tasks. I like this outcome measure personally a little bit better because it involves things like picking up tokens, but that kind of correlates to picking up coins when you're going to the store and buying something, bringing a cup to the mouth, opening a container, things that I think have a lot of functional correlation to day-to-day life. Next slide. And so this is very similar to the slide that we saw from the MFM32, where the individuals that received Evrysdi are in blue and those that received placebo are in gray. And you can see here that there was a 1.61 point increase in those treated with Evrysdi over the first year, whereas those that received placebo had relatively the same score. And again, this was statistically significant. Next slide. And again, if we look at this exploratory measure, looking at this extension period of the second year, you can see that the increases in the realm were maintained over the second year in treatment. So I'm sure everyone joining us today would like to hear more from each of you about your experience with Evrysdi. Jim, can you tell us about your experiences?
Sure. I've noticed some small improvements. Of course, I'll continue taking Evrysdi. I've been happy with the improvements, and my doctors have been happy with them also. But it's also, incumbent upon me to be the best that I can be. One of the things I always try to do is proper diet, exercise, sleep. I have to do my part in order to make this thing work. The other thing that I've always worked on is trying not to compare myself with others, be they healthy or with other diseases. It's not a matter of being like them. It's a matter of being the best that I can be. Am I doing the right things? And of course, I exercise regularly. Now, it's kind of funny because when I've always had a gym membership, and when I go in, I use all the machines in a different way than normal healthy people do. But I have figured out ways to do it. And I've had some help from my daughter. She's a strength and conditioning coach at a major university. And so if I try to cheat, she's on me really fast. And so, I encourage people to make sure they get the right amount of help there. But it's also important to note that, this disease is so slow. Oftentimes you don't notice the differences, good or bad. And so in that regard, these small increments need to be noticed. It is literally pushing a rock up the hill a little bit each and every day. And it's important to maintain a good attitude and keep the right people around you also.
Thank you so much, Jim. And I think you bring up a really good point about how important it is to take good care of yourself overall and maintain that good positive health. And so that role of exercise and healthy diet and all of those things really plays an important role as well. So what about you, Shaniqua?
Yes, so I have to agree with Jim, but I've noticed changes in my motor function, like my arm strength, and that's important to me. I can pick up small objects and open containers, with greater ease. I'm also working with my physical therapist to do more movements with my legs from a reclining position. And I've noticed some improvements in some of those movements, right? Overall, I'm happy with Evrysdi, and I'm improved my motor function has made a big difference to me.
Thank you so much. So Dan, can you tell us about what your experience with Evrysdi has been like so far?
Yeah. Since taking Evrysdi about a year now, I'm definitely feeling small improvements. Overall, I feel the difference.
I saw differences too. Well, I see them daily. His movements, his hands seem stronger. His movements that used to seem smaller are now much bigger to me, and I love what I'm seeing.
Yeah, my neurologist is happy with what he's seeing as well. Of course, this is my experience. It could be different for others.
Yeah, so I have to say, as a clinician, we definitely consider maintenance of function when we're treating SMA to be a success. I think we all want to see any type of small and subtle improvements, which is wonderful. Although, again, even just kind of maintenance can be a good thing. Oftentimes, when we're talking about the types of changes that we can see, I often ask patients about what's been things that have gotten just a little bit harder in the last year. And those can sometimes be things that we can really pay close attention and see if they start to become a little bit easier again. We've also heard differences about having less bad days, or the good days are a little bit stronger, so that there's still some of that variability, but looking at how the overall ease of things kind of goes can change. I really do believe that since SMA is a progressive disease, taking action to manage the disease is important, and I'm happy you guys have all had positive experiences so far. Another important aspect, of course, is how treatment fits into your life. Changes in our routine can sometimes be hard and challenging. So how are you handling administering Evrysdi every day at home now?
what we really like about a Brizzy is that it fits into our daily life. I've worked it into my morning routine. I get up in the morning, I start my morning, I take my Brizzy, and whatever's on the calendar for the day is on the calendar for the day. And I want to also reiterate what you said is that I do notice less bad days. And it's a liquid, so I take it every day. And even if we travel, we just take it with us.
Yeah, good or bad days, I will always make sure we just have a refrigerator wherever we go and just keep Dan's Everzian.
So what about you, Shaniqua?
Yeah, so my life is full, right? And Eversd really fits in with my routine. Like I said, I like that Eversd is an oral medication.
And what about you, Jim?
Well, for me, I do routines. I'm kind of boring in that regard, but I do a lot of routines. For me, the best time to take it is middays, not after breakfast, not before lunch, during the 10 o'clock hour. And I'll take a break then and take the medicine, wash it down with a little bit of water. For me, it's easy to remember, even though it's kind of in the middle of the day, because you don't have to go back very far to remember when there weren't any treatments or weren't any options. And to that end, knowing that there's an opportunity to take a medicine that's considered a treatment, that's exciting.
So I'm glad it sounds like all of you are remembering quite well on your own. I do tell many of my patients and probably all of my adolescents to also always set that backup alarm on their phones, which is always an easy way to make sure that no one misses their doses. I think many of us need that. So now that we've kind of gone over the potential benefits of Eversd, it's also very important that we discuss potential risks and side effects. So can we pull up the next slide? So as we can see here, Eversd safety has been studied in infants, children, and adults with all different types of SMA. In infants, the most common side effects that we saw were a lot of upper respiratory tract infection signs, including fever, runny nose, cough, diarrhea, and rash were also seen. In children and adults, the most common side effects were fever, diarrhea, and rash. Importantly, in clinical studies, there were no treatment-related side effects that led to treatment discontinuation. It's also, I think, important to note that anytime we have a new medication, these may not be all the possible side effects. So certainly if you're noticing something strange or unusual, to definitely report it to your doctor. And all side effects can be reported to the FDA or to Genentech if you're experiencing anything unusual. So now if we can go back to our panel, can you tell us about any side effects that you may have experienced? Jim, can we start with you?
Sure. You know, my doctor and I discussed the possible side effects, and quite frankly, I haven't noticed any. So for me, it's been a very good transition.
What about you, Shaniqua?
So my story is a little bit different. When I first started Eversd, I had some stomach issues, but I have been previously diagnosed with endometriosis, and my doctor said that could have been the cause. So to determine whether Eversd was the cause of my constipation and diarrhea, my doctor had me stop taking Eversd and focus on getting relief from my endometriosis. And after my endometriosis symptoms improved, we started up Eversd again, and everything was good.
And what about you, Dan?
I had zero side effects, actually.
And so you mentioned earlier kind of some of your discussions about some of the fertility concerns related to Eversd. So how have you approached that? I think you're muted.
So I'm sorry, I had the wrong slide on. Our biggest goal as a couple is to have a family. And we've talked with my doctor about that and what we could consider. We're very fortunate that my employer provides fertility insurance. So we've been able to go down that road so far. It's definitely still going to take some time. We're on that road, and but there's so many different complications that occur with my body and just with life itself. But we have hope and possibility, and we want to contribute to the world and having a child that benefits the world and raise them the right way.
Thank you so much for sharing that, Dan. Millie, do you have anything else to add?
We really want a family. Beyond our adorable dogs and cats, who are also our family, of course, we really want kids to call us mom and dad.
Yeah, between the two of us, we have this like magnetic pull for kids. They love us and we love them, and we know we're meant to be excellent parents.
That is so wonderful to hear your perspective on that. And I think your adorable dogs already made a guest appearance today.
A couple times, yeah.
We want to do that.
So it's very important to have an open dialogue with your physician team and to really continue the conversation throughout your treatment journey so your doctor can help you manage any issues that can arise. This is all really important information that I think we need to discuss. So now I'm going to switch kind of gears a little bit. We talked a little bit about the SMA community. As an adult, what does it mean for you to be part of the SMA community? Jim, do you mind getting us started?
No, not at all. As a matter of fact, you know, since I've been living with it for a long time, I've got a broad perspective on it. And to be part of the community means a lot of different things. Of course, support, encouragement, sharing of stories, and hope. The Proverbs writer said, "Hope deferred makes the heart sick." We no longer have that to be concerned about anymore. We do have hope. Not only the treatments that we have today, but also knowing that the clinicians and the researchers are running at 100 miles an hour trying to find new things. So there is hope on the horizon, and that's encouraging.
Yeah, that's really encouraging, Jim. For me as an adult with SMA, being part of the SMA community means everything because you get to be a part of a community that understands your disability and does not pity you for having one, right? It means being part of a community that's eagerly fighting for a good cause to find, a cure of SMA. It means being a part of a greater purpose than myself because as a community together, we can get way more accomplished. And the most beneficial support for me is in the SMA Women's Group on social media, and I'm a part of that. These women are great. We uplift each other and we encourage each other, right? But there's some days you just need to hear from someone who shares the same experience as you. Having others who share in your experience and pour into you is so important.
I agree with listening to Jim and Shaniqua, and after knowing Dan for so long, I feel like the unity and family and is the connections that we've made. I believe that Dan benefits from being a part of this SMA community by knowing that he's not alone and that there are others who have experienced the same things. And I'm a person who loves unity, family, fun, and inclusion for all. So I made him come in.
Millie and I first got involved with the SMA community a few years ago at a walk and roll event. I've also joined a couple of Facebook groups and been able to communicate and relate with other people through that avenue, people who have SMA. It feels good to know that there's other people just like me, but the most rewarding for me is to be able to give someone some advice or just help someone in some way, one way or another.
Thank you all so much for sharing. So what's next for all of you? Shaniqua, you want to answer first?
Yeah, so for me, I always look forward to the holidays and share with my close friends and family, right? We just had Thanksgiving. That was really fun with my family, all the food that we got to eat, actually cooked a roast. Christmas is coming up, my birthday is coming up, New Year's is coming up. That's such an exciting year for me, right? Towards the end. So I love the holidays and I love what it brings out in each every one of us, right? I'm very thankful and I love serving others and celebrating the holidays with each and every one of my friends and family. And also, I have an event planned to go to Las Vegas for my birthday, but we'll see how that goes out, you know, with the pandemic and everything.
Good luck with that. I've traveled and, you know, just got to take precautions. Cheryl and I are looking forward to our youngest daughter's wedding coming up in January.
Congratulations. And what about you, Dan and Millie?
Yeah, we're looking forward to the holidays as well. It's like our favorite time of year. It's because there's so much family and love during the holidays. That's why it's so important to the two of us.
Yeah.
I couldn't agree more. Thank you guys all so much for a wonderful discussion today. I'm now going to turn things over and see if we have any questions that we can answer now.
Thank you, Dr. Catrullo. Thank you, everyone. We're going to move to the Q&A. And like I said, we actually don't have a ton of time, but we got a couple of questions. So I want to make sure that we try to get those answered. All right. So I think the first one is for Shaniqua. Shaniqua, the question came up from one of the panelists. Are you still walking? And if not, at what age did you stop being able to walk?
I thank you for that question. So yes, I am still walking. So when I was like 2.5, my mom noticed that I couldn't really climb the monkey bars, but I still can walk right now. I use a wheelchair to get around like long distances, but I can still walk.
All right, thank you for sharing that. All right, the next question, Jim, what advice do you have for other adults with SMA who don't think treatment may be a good option for them?
Well, one of the things I'd like to, you know, make sure people understand is the difference between treatment and cure. We're talking about treatments here, but I guess primarily the overriding message for me would be do your part. Eat right, exercise, get enough sleep, do the right things, be engaged and make an informed decision about what you're going to do.
Thanks, Jim. And I guess Shaniqua and Dan, do you have anything else to add? I'll start. Shaniqua, any other thoughts?
Yeah, so I say talk it over with your doctor. If you're comfortable, talk it over with a trusted friend or someone who is in the SMA community who's on the treatment like I did, and ask them about their experience, and hopefully they can share their experience with you. However, remember that everyone's experience on the treatment is different. It's going to be different, right? Someone else's experience should only be used as an opinion to help you form your own decision. Take your time researching different treatment options and do not feel pressured to pick one right away, right? But remember that there may be treatment out there for everyone.
All right, thanks. Any
Yeah,
other thoughts? Yeah.
Yeah, I just want to say that I think as an adult with SMA, I think that it's just natural that we've accepted, you know, this disability and we've kind of gotten used to the slow progression, the slow stair step, so to speak. But now that the treatment's out there and there's an opportunity to, at the very least, stop that slow, you know, decline, I would just recommend looking into it. Talk to your doctors, find out, you know, where you are with it, where your doctor is with it, and just go from there. You can't find out until you at least do some research and talk to the doctor and try it.
Thank you. Thank you. Dr. Catrullo, a question came in. How do you talk to people who decide not to go on treatment or haven't been able to get into a neurologist for a while?
So I think the first thing is to really try to reestablish care with a neurologist. And I think we do have a lot more focus now on multidisciplinary care of our patients and really trying to improve the overall quality of life. I think it's very helpful to be very open about what your own personal goals are, because they're not going to be the same for everyone. And that's really what drives the treatment decisions, is really what your goals are as an individual. And so the more you can think about and have some ideas about that going in, I think the more that it's really helpful. I will say, when I'm talking to patients, I really do encourage them to consider starting treatment. Now in our clinic, we're often doing many of these motor outcome measures and things. And so I can't tell you how many patients tell me I don't feel any difference, and I can like see the quantifiable results. And so I sometimes do use that as something. And, you know, I mentioned earlier, but like, I really do put a focus in on, you know, what are the things that could make your life a little bit easier, or what's made your life a little bit harder in the last year or two. And I think that sets up a decent expectation for what you can hope to see with treatment, which I think is really important, because it's also important not to start a treatment with expectations that this is going to be a cure, right? We still don't have that for SMA, unfortunately, but really thinking about what type of meaningful changes you can see with your life, I think is most important.
Thank you for sharing that. Millie, someone gave you a compliment that you're hugely inspirational, and they were curious as to, you know, how did you get involved with the SMA community, and what is the focus today for you around you know, your goals for SMA and living with Dan?
I love the community and the love and the unity. That was my favorite part. I love getting together and talking and conversing with one another and learning about each other's experiences, and just getting him involved, because I didn't want him to feel ostracized, because I wanted him to feel like he belonged somewhere. And the way they made me feel like I belonged, even though I didn't have SMA, made me feel so even more amazing. And we try to attend almost every event that they have. And I just love how we stay connected no matter what, whether it was the pandemic going on, we're still FaceTiming, Zooming, and all kind of things. We had a connection, a bond still going. And I want to continue that bond no matter what, and express that to the world, and let more come in and let more know about what this group, so they can feel included.
Thanks, Millie. And yeah, the pandemic definitely made Zoom cocktail hours a thing. So yeah, you stay connected. All right, Jim. So we got a two-part question. So first part, can you answer? The second one is optional. They're asking what your age is. You don't need to share that. But the other question is whether or not you are still walking. And again, if you're not, at what age did you stop walking?
No, I don't mind the question at all. You may not like my answer, but you feel free to ask anything you want. I have been in a chair full time now for 5 years. You know, the walking, much like Shanika, where there were times where if I needed to walk long distances, yeah, I had a chair. So again, it's a slow progression. And so for the last 5 years, I've been in a chair full time, and I'm 63.
63 young.
Yeah.
All right. Thank you, guys. We actually are right at the hour. So we have a couple of other questions, but I think I'm going to respect everyone's time. And I just want to thank, first of all, thank Shaniqua, Dan, Millie, Jim. Thank you for sharing your stories with the community. And Dr. Catrullo, thank you for moderating the discussion and walking us through the data on Evrysdi. I think you always make it very easy to understand it. So thank you for your time and your efforts to everyone here. So I did want to let you know that you can find more information on Evrysdi.com. If you wanted to connect with your local PAL, you can go to Evrysdi.com /PAL. and that would allow you within your local zip code to connect with a Genentech representative who could help answer any additional questions that you have or that we didn't get to today. And then just last, before we end, the next slide, this QR code is the survey. So if you're just take a minute, we all know how to use QR codes again after seeing all our menus come up that way for all the restaurants. So please just take a minute and fill that out so we can continue to improve and bring content that's meaningful to you. And again, thank you to our panel and Dr. Catrullo.